Types of diabetes mellitus. Majorly, we have two types of diabetes mellitus. We have diabetes mellitus type 1. We have also diabetes mellitus type 2. So these are the major two types of diabetes mellitus. So let us look at the future. What differentiates these two? So the onset is sudden. But here the onset is just gradual or insidious. Then let us look at which other feature. The age at which it comes at which age? Here, any age, but usually under age, younger age, not under age, but usually younger age. Here it's for adults, usually comes in at an adult age. Size. Here, any size you can get. Any size, whether you are small, big, you get. Here, it usually attacks the big people, the obese people. Big people. We have what we call the diabetic ketoacidosis. Here it is always present. Here it is rare. Then there is autoimmunity. Autoimmunity problems, antibodies. These are antibodies. Autoimmune antibodies. Now, here autoimmune antibodies, they are present. Here they are absent. So when we proceed, you find that, let us look at insulin. With insulin, here in type 1, there is low or no insulin production. But in type 2, it can be normal. It can be normal, or it can either be normal or abnormal. Then these are the major two types of diabetes mellitus, but they are not the only types of diabetes mellitus. Let's continue and look at other types of mellitus, because we know very well that diabetes mellitus attacks only that diabetes type 1 only and only attacks young people. That is below it is around 20 and below, around there. But if you find somebody at 40 years with diabetes mellitus, if you diagnose somebody at 40 years with diabetes mellitus, definitely that is not diabetes mellitus type 1. That is definitely type 2. But if you find that the cause of diabetes mellitus in this person is the cause for type 1, then this person should not qualify to be a type 2 diabetes, will be a type 1 diabetes. But because is at an older age and is suffering the disease of the young, the type of diabetes suffering is for young people. Then that person, we call it that is suffering from latent autoimmune diabetes mellitus of adults. That is now, that one becomes our third type of diabetes. Another type of diabetes is the, we know type 2 is the one for the adult people, which we diagnose when people are adult. But if you diagnose a younger person and you find that the cause of diabetes mellitus, if you find that the cause of diabetes mellitus in a person around 20 or below, the cause is insulin resistance, which is supposed to be in adults. It means this person is suffering a disease for adults. Let us use that word. Is suffering a disease for adults. But when is young, instead of suffering type 1, which is for the young, is suffering type 2, which is for the adults. You getting me? So, because of suffering a disease for the adult when you are young, we call it modern or modern. This is maturity onset diabetes mellitus or maturity onset diabetes of young. So it becomes our fourth type of diabetes mellitus. Then also we have another type of diabetes mellitus. There is secondary diabetes mellitus. This secondary diabetes mellitus, this one comes as a result of certain conditions. Like you can have diseases to the pancreas, and we know very well it's the pancreas to produce insulin that regulates blood. So when you get diseases to the pancreas, so diseases like pancreatitis, so let's just say diseases like pancreatitis, Diseases like pancreatitis and the like. Then also, these are because of diseases. Secondary to the diseases. You get diabetes mellitus secondary to diseases. Then you can also get diabetes because of medication. So medication like which medication? Like the beta blockers. The beta blockers. The example of the beta blockers, we have this one they give them, which we give people suffering from high blood pressure, hypertension. We have propranolol. Bisoprolol. We have atenolol. We have also thiazides. So that is our fifth type of diabetes mellitus. We have gestational diabetes. Gestational diabetes mellitus. This is our sixth type of diabetes mellitus. This one usually disturbs people with pregnancy. There are people who become diabetic when they are pregnant. Especially it affects ladies, of course. There is no man who gets pregnant. Not so. Are there men who get pregnant? So usually it attacks ladies when they are pregnant. It can be, sometimes it can have poor insulin production and it has two. Sometimes insulin production, improper insulin production and resistance to insulin. They get problems. Then is malnutrition, diabetes mellitus. So this malnutrition diabetes mellitus, it is just a primary, a secondary, just secondary to. It is like this secondary diabetes mellitus, just secondary to poor nutrition or to malnutrition, whereby it is more related to diabetes type 1 in that there is a problem in the production of the insulin by the beta cells. So the beta cells, they don't produce insulin or enough insulin because of malnutrition other than autoimmune problem.